News now at 7. Open enrollment now underway for more than 1 million Georgians buying coverage through the public marketplace.
But this year, tax credits that make coverage more affordable may not be extended. Atlanta News First, Abby Kasouris explains.
64-year-old Gareth Finley shopping for next year's health plan during open enrollment. She qualifies for and receives a monthly premium tax credit under the Affordable Care Act that helps keep her insurance within reach.
There's my AIPTC of $12.13.
But this week, she was stunned. Her monthly premium had doubled, and her ACA tax credit totaling $1,200 a month she may or may not get. That's now up to Congress.
I think the U.S. has amazing health care, but the financing system for it is just kind of bizarre and broken.
Right now, nearly 1.5 million Georgians rely on these tax credits to afford their insurance, and 93% of Georgians on the ACA marketplace depend on those credits to keep their coverage affordable.
These primary care emergency rooms, they'll end up closing in rural areas like where I live.
The debate over these credits is now at the center of the government shutdown. Democrats say extending them is urgent. Republicans argue the pandemic-era subsidies were meant to be temporary, and that keeping them allows higher-income households to receive taxpayer-funded assistance. But Congresswoman Marjorie Taylor Greene has broken with some in her party, posting that she's absolutely disgusted insurance premiums could double if the credits expire, and signaling she's open to negotiating a deal with Democrats. Finley worries what would happen if she gets really sick or hurt.
It is absolutely essential. There's just no way around it. I can't see our country sustaining our healthcare system and economy and well-being.
Open enrollment runs through January 15th. If Congress doesn't act, experts warn that thousands of Georgians could be priced out or lose coverage early next year. In Atlanta, I'm Abby Kasouris.
So how can you protect your wallet and save some money amid this price hike?
Atlanta News First investigative reporter Anastasia Olmos has a closer look.
The loss of COVID-19 tax credits has many Georgians feeling sticker shock. We tested out the Georgia Access Estimator website and found that those enrolling are seeing their premiums triple or even close to quadruple. For example, with Georgia Access, we found a couple making $85,000 a year in DeKalb County will see a 216% increase from $350 to more than $1,100 a month. A family with 3 children in Gwinnett County, we're seeing an increase of 180% from $200 to $550 a month. We're also hearing many people are seeing deductibles near $15,000. But it's not just marketplace insurance. Experts with the financial company Mercer say health insurance for those looking through their employers will also likely see a 6 to 7% increase due to the rising costs of health care overall. Here's what you should keep in mind as you shop for coverage. Make sure your account is not on auto-enroll. Last year's coverage may not be the best option for you anymore. If you can't afford the upfront costs, consider a lower premium with a higher deductible later to give yourself a chance to save money if you should need extensive medical care. Verify that your preferred doctors, specialists, and hospitals are in the plan's network, and make sure your current prescriptions are covered and your preferred pharmacy is also in network. Look for free preventative care and wellness perks like annual checkups and vaccines. If you need coverage starting January 1st, you must enroll by December 15th. However, experts advise that you keep checking back to see if plans go any cheaper. And if you can wait until the deadline, they say Congress could end up approving further tax credits. We have more details on avoiding scams and hiring a broker on our website right now, AtlantaNewsFirst.com. I'm Anastasia Olmos, Atlanta News First investigates.